Hello everyone. This is Dr. Akif. Today we are going to discuss about pulse oximeter, which we commonly use nowadays. For all the COVID patients, we advise them to keep a pulse oximeter nearby them. So what is also important is that many people don't know how to use it and how to interpret the reading. So they unnecessarily get worried about it. So for that clarification, we are making this video. So see, whenever your doctor advises you to get a pulse oximeter, so this is a common pulse oximeter you can see. So see, what you need to do is one is there is a finger end. It is there in this side. Okay. So before putting your finger, what you need to do is two things you should avoid. Your hand should not be wet, or it should not be cool. So whenever your hand is wet, like if you have just washed your hands with water, or if it is cool, what happens is that time the blood supply to that part of the hand is decreased, and there can be a decreased values of oxygen levels which you can get in this reading. So you have to remember that whenever you check your oxygen levels, your hand should be always warm, or it should be completely dried. So if your hand is wet, you should dry with something, or otherwise what you need to do is, for to prevent it from cold, warm your hands for some time. So you warm your hands, and when it is warm, then only you check your oxygen level. So there you put it in your anything. You can use any of your fingers. You put in your fingers, okay, and then there is a start button. So somewhere it is given here. In some machines it is given at some part. You can see the on button here. You press the on button here. Okay. So once you press the on button, you see there are two things which it is showing. Okay. So one is written as SpO2. You can see it is as SpO2. So other thing is the PR or HR. What is PR is? PR is the pulse rate or heart rate. It is the number of times your heart beats in a minute. Okay. So that should be from 60 to 100, the below one. So what is important for us is to see the oxygen levels. So it is showing as 98. So normally it stays more than 97 for almost all healthy patients. It is normally more than 97%. So if you are showing it is showing 97 to 100, you need not worry. So what is also important in a COVID patient is that you should check your oxygen level at rest, and also you should check your oxygen levels after 6 minutes of walk. Okay, so if there is any underlying lung damage, if you want to detect it early, the 6 minute walk test is very important. So what you need to do in that case, you need to walk actively for minimum of 6 minutes. Like if you are home quarantined or anywhere, if you have some space where you can walk, you walk there. It should not be a casual walk or a slow walk. It should be as active as you can, or you should walk till you get breathless. So, okay, so either you should walk till you feel any breathing problem, or you should walk for a minimum of 6 minutes. So after 6 minutes of active walking, I repeat again, it should be active walking, not be a casual walking. So after you walk for a minimum of 6 minutes, you check your oxygen levels again, and if it is dropping by more than 4%, if it 4 or more than 4%, then only it should be considered significant. Okay, I repeat again, if it is dropping by more than 4%, then only it should be considered significant. For example, if your oxygen levels was 98% at rest, and if it is dropping to 94 or lesser than that, then only it is considered significant. It after walk, for even for healthy patient, it may drop by 1 or 2%, which you should not consider. Like even if I walk for 6 minutes, my oxygen levels may go from 98 to 97 or 96. So for that, you should not get worried. If it is dropping by more than 4%, then only you should immediately consult a doctor or visit a hospital. Okay, and and remaining, you think you can follow as whatever your doctor advice. So like how many times you need to check your oxygen levels is also should be based on your doctor's advice. Do not keep checking it every time and get worried. Follow as per your doctor's advice. Thank you.